actually a state asset. The team is a partnership between the Tennessee Department of Health and the Tennessee Federation of Fire Chaplains, and we provide free services across the state for critical incident stress management, critical incident stress debriefing, mental health first aid, psychological triage, and suicide intervention. We currently have about 110 members across the state, and we respond to any group in need of those type of services. We were activated through the Tennessee Emergency Management Agency, or TEMA, to respond to this disaster in Northeast Tennessee. So we've had a team on the ground since Saturday serving Washington, Carter, Greene, Unicoi, and Johnson counties, and are primarily focused on first responders, the community at large, those who have been rescued or in shelters, and any other departments such as responders as far as county employees, city employees that may need mental health intervention during this time. Services or counseling, we can do group debriefings or diffusings, and then we act as that warm handoff to a higher level of care, such as a mental health provider, if we feel that that is necessary. So at this time, we have approximately 20 to 25 team members in Northeast Tennessee. About half of those are concentrated here in Irwin, since that is one of the most majorly impacted areas on this end. We also have, again, teams in the other 4 regions that have been affected. We do have an 800 number with a centralized dispatch that can get a hold of team members that, if there's someone who needs to talk to someone one-on-one, or if you have a first responder agency or any type of company or community group that's been affected by this disaster, and you would like for us to come in and do a debriefing or just talk to your employees or people that have responded, we can provide any of those services. So it's top priority. If you don't have good mental health, it's going to start to affect your physical health. And it goes both ways. But it's not two separate entities. It's all your health. And we have to maintain our health. So by utilizing this team, by talking to people, by talking through things that are bothering you that you may have been exposed to, we can actually prevent additional problems down the line, like post-traumatic stress or post-traumatic stress disorder. So we just encourage, right now our responders are in responder mode, so we're going to be here for the long haul. So when things are calmed down, then we're going to go back in and we'll be there on the other side to be able to sit down and talk to them for extended periods of time.